Very much. Next, we have Dr. David Margolin, professor of surgery at the Ochsner Clinic in New Orleans, speak about colorectal surgery fellowships.
Thanks for having me. I'm representing the American Society of Colorectal Surgeons as well as the American Board of Colorectal Surgeons today. Unlike what you've heard, colorectal surgery, we are specialists. We don't want to be broad. We want to focus on diseases of the colon, rectum, and small bowel for inflammatory bowel disease. So the questions that were posed is, what does it mean to be a colorectal surgery? What does it mean to do the fellowship, and what are the benefits? Well, colorectal surgery, it's a one-year fellowship, as I said, specializing in diseases of the colon, rectum, and anus. And we concentrate on those diseases with major open surgery for cancer and benign disease. Minimally invasive surgery, laparoscopy, is a huge part of colorectal training, as well as robotics now. Also, though, we have transanal surgery. Again, that's where the forefront of really going, what we can do through the natural orifice. And a big part of colorectal surgery is endoscopy. All of these to allow you to better take care of your patients with disease specifics. So what does it mean to be a colorectal surgeon? Like I said, you really are a true specialist in benign and neoplastic diseases of the colon, rectum, and anus. You collaborate with the oncologists for management of your cancer patients. We follow them more than I did when I was a general surgery resident. As you said, you see these patients. We follow them fairly closely. We also deal a lot with the gastroenterologist for benign disease. So you have to learn how to develop a good working relationship to help take care of your patients. It's collaborative. One of the nice things where I am is we deal with a lot of IBD. Well, our gastroenterologists don't treat these patients medically until they're train wrecks and send them to us. We work collaboratively to get them to surgery when we can still affect their quality of life. Another nice thing about being a colorectal surgeon is you get to tailor your practice. People I've trained with still do major abdominal surgery. However, some just do proctology. They do anal rectal surgery and scopes, and they have a lifestyle that they're happy for. They're not called in the middle of the night. So it's something that you can tailor your practice for. It's also something that you can tailor your practice for as you get older. You know, as I'm getting older, I'm seeing what they're talking about. It's like, yeah, no, I like doing big cases, and I like doing big rectal cancers, recurrent rectal cancers. I'm getting less and less enamored with the 6-hour open pelvic dissection. And as I get older, I realize that, you know, I can tailor my practice to where I'm not doing major abdominal surgery, where I'm doing endoscopy and anal rectal cases and seeing more of my family. Or I'm just too tired to do this. But that's one of the advantages, is this really is a practice, and colorectal surgery is something that will carry you through your whole career. You really don't get boxed in, and you can design it how you want. So the important steps in applying to colorectal surgery fellowship. Pay attention to the deadlines. You've heard this before. The deadlines are the deadlines. This is through the match program. If you miss the deadlines, you're out. The interesting thing, and we're going to talk about that in a second, is the whole interview issue. First, before we get to that, identify a mentor. Find somebody in your training program who can give you a little bit of guidance, someone who can explain to you what colorectal surgery is and what you can expect in the future. You know, research the programs. Find a program, and that's not doing research, that's research the programs individually. Find a program where you find people there who have interests that are similar to you. I do cancer research. I also do incontinence research. I know they're completely opposite, but if that's something you're interested in your practice, look around and see what the people are doing at the program you go to. That will help you in your career more than anything. The application process, again, letters of recommendation are very important, as well as talking to people at your institution. You know, we did a survey that's going to be presented in 2 weeks at the American Society of Colorectal Surgery's meeting of the program directors. And everybody said the interview was probably the most important thing. But there's a catch, and that's a little bit disingenuous, because what happens is you have to do something to get an interview. So it's not just the interview, because now with the ERAS system, we get 100 applications, but we only interview 20 people. So yes, the interview is important, but when people tell you it's the most important thing, take that with a grain of salt. So you've seen this graph before, so forget it. Thank you, Ezra. But so what this shows is it is becoming more competitive, and the numbers are the numbers. So there's still more positions, there's more applicants than there are positions. So what can you do to maximize your application? Solid general surgery training. Really learn how to operate. Take advantage of what you have at your program. Spend as much time in the OR as you can. Read. Do well on your ABSITEs. The letters of recommendation are very important. Phone calls are important from people, from your mentor or somebody you've worked with or done research with. It makes a difference. And as I said, the interview process is important, but it's not the only thing. It is a little bit disingenuous. So this is some of the results of our surveys and that we sent out. We sent them out to program directors, people who were matched this year, so current colorectal fellows, and people who graduated within the last 2 years. So those are the recent residents. And what you can see is what were the most important things. The blue line is the program directors. And again, so we're going to ignore the interviews because, again, that's somewhat disingenuous. But colleague recommendations, letters of recommendations, and ABSITE scores, which tells us as a program that you did well in your general surgery training, that you are a viable candidate who we can be proud of when you graduate. You know, when we interview people, I kind of tell them it's like a marriage. You need to find a place where you're going to be happy, but you are always going to be a Cleveland Clinic fellow or an Ochsner fellow. It doesn't matter if you're a colorectal surgeon where you did your general surgery. Because there's about 1,500 of us in the country, you will always be known as an Ochsner fellow. Find a place where you're comfortable that will give you the training that you need. Here's the case numbers that you need to finish your fellowship. So you need 60 anal rectal procedures, you need 120 abdominal procedures, 50 segmental colectomies, 30, and that number is going up, laparoscopic resections, 20 low anterior resections for malignancy, 5 abdominal perineal resections. You need 140 minimum colonoscopies and 30 anoscopies. These are the bare minimums. Most of the programs get them. And again, it's important for you thinking about what you want to do in the future to find a program that specializes or has the numbers that you want as well. And the programs will give them to you when you interview. So at Ochsner, we meet all of the numbers. We're very top-heavy in endoscopy. The fellows will finish with about 600 colonoscopies. Some programs meet the bare minimum. Others, though, have more laparoscopic surgery, even though we're well above the minimum. So again, do your research too. That's part of the job that you have. What happens when you're done? What can you look forward to? Well, this is the results of that survey. What happens is 32% of people finish their colorectal surgery fellowship and only do colorectal. As you can see, some do general surgery. Very few do majority general surgery. Some do about 50%. Most of the fellows that leave end up doing about 25% or less general surgery. The other thing is there's been a sea change since I was a fellow. When I was a fellow and looking for a job, there were very few academic jobs. This was mostly a private practice specialty. However, in the last 10 years, what you've seen is the academic institutions have realized that colorectal surgery brings a value-added service to not only academics, but to the patients that we take care of. That also gives you more opportunities to do research in colorectal surgery. So really, again, tailoring your career for what you want it to be. Okay, we can't do this without money. Here was the response of the 37 and what their salary levels were 1 year out, just so everybody knows, because some of us, well, mine are done. Some of us has loans to pay back, and you've got to live. So the salary's all over the map, but you can see that for yourselves. So really, colorectal surgery is a chance. You do have a board exam that you have to take. Actually, the American Board of Colorectal Surgery is older than the American Board of Surgery when you look at the American Board of Medical Specialties. It is a board exam. To be qualified to take that exam, you have to pass your written general surgery exam. It gives you a chance to be a true subspecialist, to tailor your practice to a disease where you can really concentrate on learning this, and you can collaborate with other people who have the same interests as you do. It's nice not to be a generalist. I really enjoy being able to concentrate on diseases of the colon and rectum. And I think most people will too, finding that specialty niche.